community has always been at my heart. I fell in love with one of my placements with one of the district nurses, and yeah, it was just where I knew I wanted to be. The community provides so much more holistic care, and you're surrounded by the families and the patients' creature comforts, which enables their healing so much faster, and they don't feel so stressed out when they're in hospital.
We see a lot of complex patients in the community now. It's not just dressings that we do. We do a lot of different clinical skills that have been brought in. We have a lot more acute patients coming into the community that are requiring care. And you know, providing support to the families and their patients, as well as each other in the team as well. Not only do we obviously look after our patients on a day-to-day basis, we kind of look after each other as well. The benefit of keeping people at home is that they heal quicker. They're in their home setting, so they're more comfortable. It saves the pressure on our NHS and in the hospitals.
Oh, hi. Fine, thank you. How are you?
Not too bad. Good morning, Ben.
Oh, you know.
Busy?
Chaotic.
Hi, Mags. How you doing? Right, my lovely, shall we go through?
Yep.
Yeah? You get to use your own clinical knowledge, your own clinical skills. Obviously, you work autonomously, but you have your team behind you, and not only do you have, you know, your community team, you have the multidisciplinary team as well. So if we can always bounce off of each other just to get a little bit of advice if you're not sure, you feel like you've done everything, but what's next? What else can we do? With the GPs, we speak to them on a day-to-day basis regarding every kind of patient that we have. We were actually part of a pilot study with 3 of our main GPs that we deal with, that in the morning that we would talk on a huddle and be able to communicate any like safety concerns or any concerns regarding patients from us or from them, to try and get an action plan to prevent hospital admissions, to prevent, you know, infections, those kind of things, and escalations that, you know, could be preventable in the community instead of having to go elsewhere for it.
Within the first year of being with the Trust, I was a fully competent community staff nurse. The Trust has provided me with many different skills, different courses. I've never found them to turn me down for anything that I've wanted to do. They invest highly in their staff because they want the best for them and they want the best for the Trust. What I'm hoping to do, I'm in the process at the moment of applying for the District Nursing Apprenticeship Programme managed by Plymouth University. It's a 2-year programme which will then give me the Master's degree in District Nursing. This will also enable me to be a non-medical prescriber. It will give me more leadership skills and more clinical skills to progress further and to become a better leader for my team. There's plenty of opportunities no matter what field you want to do within the Trust.
As a community nurse, my final placement was with Liscar Community Nurses. Never had any community experience before. There was a team lead here at the time who totally inspired me. The way the team ran, the just the cohesiveness of it, the quality, I was just really impressed with. It just inspired me. There was also something about being out in the countryside, being out in that fresh air, driving along, and just the animals up on the moors, or you could be down on the beach and driving past all the sea. Was just absolutely beautiful. Does wonders for your well-being. And that's, you know, sometimes you have to remind yourself, absolutely, look where we are, look how beautiful this is. And I think CFT really do support that. They encouraged a wellbeing afternoon last year with the team, and as a team we all went off to Loo. We went off in a fishing boat and had a great afternoon round. I think it was around the island, had a look around the island, and then we had pasties on the beach. Some of us went swimming, and we literally stayed there all afternoon. It was something that the team really valued. It really pulled the team together, and we'd like to do it again.
This situation came about nearly 7 years ago when I had a spinal stroke, and it was all quite dramatic at the time, and I got blue lighted off to Derriford Hospital in Plymouth, and then after 11 weeks in Plymouth, they moved me to Salisbury Spinal Hospital, and I had 5 months in Salisbury where they treated me beautifully and wonderfully, and hence Christmas I was allowed to come home.
The big drive is to keep people at home at the end of the day. It's been recognised that they are better suited, they adapt well to treatment, and they live better. Working in the community for Cornwall Foundation Trust comes with many, many opportunities. Working in Cornwall as well, you've got these beautiful views behind me. It's just a lovely environment to be in, and I wouldn't want to be anywhere else.
You'd get a lot of clinical support. We've got the community matron as well that's very good at supporting, and we've got a really good experienced team. You'd be put on all the training programmes, and you'd have some supervision, and we'd look at what interests you, what skills you bring, because you've obviously, you're a nurse, you've come with skills that are going to enhance my team, so it's not always about what's going to happen, you know, how am I going to fit in. It's you know, everybody benefits, so it's seeing your skill mix, and looking at training and development, see what your development pathway, what is it you want to do future wise, what do you aspire to.
We celebrate each other's differences. We recognise that, you know, people are not all the same. We all work differently, and we have things that make us unique. We're non-judgmental. It's a real free space where you can share ideas.
When you've got that strong team and you've got the same ethos and the same drive, then ultimately that's what we're here for, and it's about patient care. Hello, Philippa speaking.
Hiya Philippa, it's Tony. Have you got a moment to talk about one of our patients who's on the TMP therapy?
Oh, hi Tony, yes of course.
It's just that his wound's healing really well, and I'd like to reduce his visits. I have photographed the wound and completed all the tissue viability templates, and I plan to discuss him in the patient review meeting, along with changing his care plan.
It sounds like he's healing really well. Lovely. It sounds like you've covered everything as well, Tony. All I would say is that probably we need to run this by tissue viability and just show them your assessments, but absolutely great work.
Okay, thank you Philippa for your support.
Thank you, well done, thank you.
Bye.
Take care, bye. The evidence is in the results, and the fact that we're healing, you know, we're having good healing rates, that we're having good comments from patients that they're actually having a really good experience. So that to me is the evidence that we're doing well.
The district nurses that come every day, they save my life every day, and they are the just greatest gang I know. They really are. Because of where my spinal injury was, I can suffer from a thing called autonomic dysreflexia, which takes a bit of learning how to say. But I've only, touch wood, had one case of autonomic dysreflexia since I've been at home. It can be really, really, really frightening. And that's why I find every day when the district nurse comes, each time they leave and I'm left to do my bit, they are my best friends for the day, because, you know, they just come and save my life every day.
The best thing about working in Cornwall is just the freedom that you have. You've got all these beautiful sights, roads, the weather is just amazing in the summer. It's nice once we've finished a day's work just to grab your bag and go down to the beach. There's surf schools around nearly every corner. It's just a really nice outdoorsy atmosphere. Driving the car around during the day it's quite therapeutic actually. You don't have as much congestion like you would in the normal built-up cities. The roads are clearer, the views are just amazing. I have to pinch myself when I drive along here because I just look out and I just think, wow, this is where I work. It's what you see in movies.
If you're looking to change your job and would like to work for inspiring leaders, this is the place for you.
Come and work for Cornwall Trust. I can guarantee you won't regret it.
Why don't you come and join our team in Cornwall and see for yourself what it's like to work here? You won't be disappointed.